Hello and welcome to Dental Wealth Builder. My name is Dr. Bhavna Doshi, and today I'm going to talk to you about how to successfully increase your case acceptances to significantly grow your practice. But before we get into that, I just wanted to fill you in on a little of our background. So I work in partnership with my husband, Dr. Rahul Doshi, on all ventures. We're both dentists and have worked now in the dental industry in the UK for over 30 years. Throughout our careers, we've been associates, owned multiple businesses and dental practices, and we've been through the buying and selling processes, so we understand what it means to build value in a dental practice. We're also dental business coaches for Dental Wealth Builder and run various training programs for associates, practice principals and team members. In fact, I'm very proud to say that 100% of practices we've worked with have achieved over, as a minimum, 20 to 30% increase in their turnover. We've had award-winning practices, and the latest accolade was given to Rahul for his most outstanding contribution to dentistry. Rahul spent much time working with the British Academy of Cosmetic Dentistry and was voted president of the BACD in 2018. He's also worked a number of years as clinical editor for the Premium Practice Dentistry magazine in the UK. And we've both worked as judges for the National Private Dentistry Awards in the UK for the last 15 years. We're both international speakers and have lectured in multiple countries all around the world on various aspects of clinical dentistry and business. Rahul is currently the Clinical Strategy Development Director for Dentex, which is a corporate entity where he guides just over 84 dental practices, so we've got much corporate perspective too. We've helped thousands of dentists through the Perfect Smile Advanced Training Institute, where we used to hold business courses and clinical hands-on courses on comprehensive full mouth cases, treatment planning, occlusion and smile design. We've got much clinical perspective to impart when required too. And we've had multiple media appearances and were at one time the go-to dentist for media consultations regarding dental current affairs. We've been on numerous TV programs and were the main dentists on all seasons of Extreme Makeover UK. So you can see that we've had much experience under our belts as contributors, coaches and opinion leaders. So we have much to share with you. So, when it comes to successfully increasing your case acceptances, you want to grow your practice by doing this. But before we get into that, I want to define case acceptance. And this to me is when the patient is accepting and saying yes to your recommendations of a treatment plan that you've diagnosed and are proposing. In most cases, small fee-based treatment plans are easily accepted. However, I'm talking about patients accepting comprehensive treatment plans that are usually associated with higher fees. Many dentists find it easier to sell single tooth dentistry or quadrant dentistry, simply because it's less complex and easily understood by your patients. However, when it comes to larger cases that are more involved and more comprehensive, such as full mouth rehabilitations, single arch dentistry or implant dentistry, then things become a little bit more difficult and challenging. Another term I want to define is selling. You'll find that I use this term interchangeably with the term increasing your case acceptances. However, the word sales or selling has had many negative connotations associated with it in the past, so I just wanted to define it on what I mean. Selling is the process of helping someone discover something of value and hence they're happy to pay for it. What I don't mean is forcing a sale or incorrectly advising the patient. We need to be ethical at all times. So that is really the only way to grow, to remain ethical and always advise the best in the best interests of your patients. You need to be advising dentistry to your patient that you would have in your own mouth. And you're not here to sell a service. You want a service that just sells itself. So you only want to be selling that dentistry that you'd have in your own mouth were you that patient. The only way to achieve success is by a win-win-win situation where everybody is winning. You are winning as the dentist, the team is winning, and the patients are winning. That is the only way to achieve success. And in my mind, that is the very definition of success. In many instances, however, there are numerous barriers that form challenges to your success. And success means different things to different people. However, in this instance, we're going to define success as gaining and increasing your case acceptance rate. This in turn will lead to a more profitable and successful practice. Now, patient expectations are increasing, mostly due to the huge volume of information now available to them. However, too much information can leave the patient confused as to the best choices for them. And there are now so many practices claiming to be able to facilitate the needs of the patient that it further complicates the situation. This means that communication is a vital tool. However, there are many components to successful communication and many layers to it. Without comprehensive understanding on both sides, both you understanding your patient and the patient understanding you, a case acceptance, especially of high-value treatment plans, becomes increasingly unlikely. So how do you differentiate yourself and provide that much-needed clarity for your patients? Patients are living longer, they want to stay healthy, and they want to look good at their age. This means that dentists have an increasingly important role to play in improving the appearance and maintaining the function of a dentition. This shift in focus from treatment of disease alone to improving the quality of life is a significant trend that is impacting our daily work. It's moved dentistry from need-based service to a want-based service. Now more than ever, it's become critically imperative to create a case acceptance process that allows both the dentist and the patient to co-discover the needs and requirements of the patient. This will then prompt discussion of relevant treatment options and provides value in your practice. It also enables you to exceed your patient's expectations with effective communication. However, in many cases, and I've personally seen this over the years, in order to gain success, most dentists focus primarily on their clinical skills, and that's probably exactly how it should be. However, the reality of the situation is a little skewed. You see, most dentists believe that if they want to achieve great success, that solely focusing on their clinical skills will be enough. So they strive to become more efficient and proficient in these skills. They spend much time, money and energy on postgraduate training, acquiring equipment and gaining technologies. Now, all this certainly helps in improving your confidence and your ability to deliver optimal treatment, and perhaps on how your colleagues perceive and respect you. But it doesn't quite mean that you will be the most sought after dentist and be able to practice the type of dentistry that you've learned and hence develop the experience in that field. Your clinical ability and how much success you achieve are unfortunately not proportionate to each other. The more clinical capabilities you have does not necessarily mean you'll be more successful. So after a while, dentists begin to realize that their skills, tools are remaining redundant and that they're not getting the right caliber of patients going ahead with their recommended treatment. This is mostly because there's no communication structure or coordinated sales process or systems in place that enables you to do that. And because of this incorrect belief, many that I know have poured huge budgets into learning clinical dentistry. However, You want to gain a return on investment on your time, energy, money and training that you've spent on learning that clinical dentistry. Also, to get that experience you need in that type of dentistry that you enjoy. So what you're really looking for is to do more of the dentistry that you enjoy. Some of you may be wanting to move towards more private work from NHS work, or you might already be doing quite well, but you just want to level up and perhaps do more implants or more cosmetic cases. Perhaps you want to do more complex cases that involve higher end dentistry, full mouth rehabs. Something that challenges you and allows you to reach your potential in your career. Something where you look at and you think, yes, that was very satisfying to do that treatment. Some of you feel that you might have compromised your passion and that you're now doing treatment that you're not quite enthusiastic about. Or you may have been on courses to learn a particular style of dentistry, but that you really enjoy, but now you're not doing enough of that dentistry, and hence those skills are remaining redundant and you're not able to become a master at that style of dentistry. And also, despite spending huge amounts of energy, time and resources in communicating with your patients, you might feel that you fall short every time. It seems like you're on an emotional roller coaster and you find it challenging to get through. Eventually, your treatment plans get heavily influenced by what the patient feels is important or not. And this leads to compromised treatment from your perspective, often involving single teeth without the comprehensive care of the entire mouth. Hence, the treatment plans are lower in value and holistic completeness. And this in turn leads to reduced returns and a sense of loss of control. This is why patients keep coming back to dentists for doing bits of dentistry, fixing one or two teeth, as opposed to fixing their entire mouths. Hence, you might feel that you're not getting the adequate income in relation to the amount of hard work and effort that you're actually putting into your practice. Incorrect actions or inaction by the team can result in ineffective and inefficient sales and internal marketing processes, the consequences of which are poor financial results and much frustration on your part. This becomes demoralizing over time, and practice owners begin to not trust in their own decisions. And this is when you start falling into a repetitive cycle until practice declines. Despite continual reform, many practice owners find it increasingly challenging to motivate and inspire a team that appears to have lost its mojo. This leads to a breakdown of team efficiency and effectivity, resulting in probably a lacklustre customer service. Staff are often only working for a paycheck rather than the genuine enthusiasm and passion for their work. You might find that you have non-impactful communication occurring in your practice. Communication is something that we all do, but whether it's effective or not is actually another matter. Communication is simply a transmission of meaning to others, and it's important that the other person that we're speaking to actually understands what we want them to understand, and that they understand the intended meaning. And in order for that to occur, we need to carry out purposeful communication. All too often, under pressure, we tend to focus on communication as what we are saying, as opposed to what needs to be understood. In our jobs and lives, if we learn to communicate effectively, there will be many benefits, not just for ourselves, but also in those that we communicate with. And gaining case acceptance, communication is at the core of this process. Also, without proper structure and coordination, the team are not able to be fully engaged in increasing your case acceptances. In many practices, the team are not properly involved in the sales process itself, and this creates over-reliance on the dentist or treatment coordinators. And I've just found this to be an inefficient sales strategy. Not only that, but so many practices concentrate on operational systems alone. Things like CQC, ordering stock, invoicing, the things that you need for the practice to remain open. A better strategy would be to concentrate on both operational and growth systems synchronously. Growth systems are directly proportional to the practice revenues, which means the more you work on growth systems, the greater the increase in your revenues. And this is not the case with operational systems. If the team are not trained in the growth systems for sales, then you're going to find inaction amongst the team. And this can be due to underlying insecurities or anxieties affecting their self-concept of how well they can perform on a particular activity. This in turn leads to a misaligned team where everyone is on different wavelengths. And for this reason, it's critical that the team are trained in the psychology and the theory behind sales and what you are doing. Essentially, why they're doing something, and before demanding any particular action. If the team understands why they are doing something and the impact of that, then when circumstances change, they can use their own heads and imaginations to provide an alternate solution. This creates less reliance on the practice manager and the practice principals. So we need to get the team aligned into the vision that we're trying to acquire. Often when it comes to increasing case acceptances, most practices have variable results. There's no consistency of gaining a yes from your patients, and therefore there's no consistency of the results that in turn facilitates the practice growth. Too many practice owners get wrapped up in working in their business and they leave no time for working on their business. They leave no room for proper team management and progress. Some do a bit of everything, but in a reactive and unstructured manner. Practice owners then lose confidence in their own management abilities and start operating from a place of fear. This more often causes chaos, leading to never having enough time to make those positive changes necessary for your practice to grow and increase your profits. And then what tends to happen is that the daily routine for everyone is not organized or uncoordinated, leading to increase in stress. And if you add to that no proper teamwork occurring and poor leadership, they all contribute to increased stress with you. What you want is a better lifestyle with more time off so that you can re-energize and refocus. However, without compromising your income. So what you're really looking for is a balanced lifestyle. This way you can further fuel your passion for your work and be able to work in a state of flow where you can reach your highest potential. Let's just take a look at some maths here. If you were able to increase your case acceptance rate by maybe 2 extra Invisaligns a month or 2 implants, say for example, a month, then you've actually got the potential to increase an additional and create an additional revenue of income of £7,000 a month. Now in a year, this could amount to £84,000. This is significant enough. However, let's just elevate this a little bit. Say you are now able to increase your case acceptance rate of, say, 3 Invisaligns a month, or maybe 3 extra implants a month. Alternatively, you could do this with one large treatment plan that you are able to sell that month. You then have the potential to create an additional revenue income of £10,000 extra a month. In a year, this could amount to £120,000. What would that do for you? How significant an impact would that have on your life? You have the potential to increase your 10-year turnover by £1 to £3 million, increase your EBITDA, and increase your practice value by £1 to £2 million. This is no small prize. What you want is to liberate your lifestyle, create that financial wealth and security through your practice. So how do you achieve this? Well, let's look at this in a bit more detail, especially when it comes to gaining financial returns. Take a look at this graph. The amount of effort you put in is represented by the vertical axis. The horizontal axis represents the success you attain as a result. What tends to happen to most dentists is this. Initially, you're content because sales are remaining within your control. But eventually, you realize that you are continuously faced with a barricade, a wall that's preventing you from achieving the type of success that you want. The wall represents the challenges you face in combination that contributes towards a barricade. These challenges could be things like the practice is not marketing well, there's no proper sales happening, so you're not getting the right type of patients. The team are not trained, or team motivation may be low, or you don't have the right space or equipment. Your patients may be difficult, you don't know how to sell, so on and so forth. You start off with small amount of copable challenges initially, but eventually these escalate to become real barricades, real challenges for you. And this is true for anyone who wants to level up. So it's true if you want to move from NHS to do more private. It's true if you want to increase your average treatment plan from £1,000 to maybe £3,000 or £5,000. It's true if you want to do more comprehensive and complex cases where your average treatment plan is over £10,000 to perhaps £30,000. It's true even if you want to just increase your income, you'll be faced with these challenges. Some of you maybe want to buy more practices and own multiple practices. More importantly, whichever level you want to get to, you want to do it in a way that gives you less stress and more rewards. So what you need to do is to break down that wall. However, there's a whole different scenario of things that happen before the wall and the way things are and should be after the wall. So we need to understand what's happening on both sides of the wall. Before the wall, you're in your comfort zone where your ability has limitations. However, despite that, the sale of smaller fee treatment plans are easier, mostly because they're less complex. There's less problems in your patients' mouths. The patients tend to be younger and hence lower risks are involved in the treatment. The treatment plans are smaller, and there's less for the patient to consider and understand. The concepts of dentistry involved with smaller treatment plans are easier for the layperson to comprehend. So it's simply about educating the patient about the dentistry. And so usually the patients just go ahead and take your advice and your recommendations. Word of mouth marketing works more in these types of cases, mostly because the fees are lower for each treatment plan. There's less complications, easily understood, and therefore more patients are happier. And also the team as well, they understand simpler dentistry, and so you don't require much additional skills from them. So invariably, before the wall, things remain in your control. However, on the other side of the wall, things start to becoming a little bit tricky. And it's mostly because things are more complex. The types of patient that you need are in more need of comprehensive care. So we're dealing with higher fees here. Usually past the wall is where your occlusion is involved now. So it's dentistry where you need to take care of the occlusion. So we're dealing with higher fees and more private work that the patient now has to consider. And the patient will tend to have more oral problems and hence higher requirements. They tend to be older with deeper oral disabilities and deteriorations, and the treatment plans are complex and larger. And as I mentioned before, associated with higher fees. So the patients aren't going to say yes easily. They need time to consider your propositions and recommendations. They need time to better understand what they are exactly paying for and why you are recommending this to them. They don't want to be making expensive mistakes. Nobody does. So now they're going to be looking at trying to understand what you're proposing. And therefore it becomes more about patient perception of the dentist, i.e. your personal brand. They're going to be looking at the overall team dynamics and the brand reputation of the practice. So now internal and external marketing becomes increasingly important. The practice needs stronger marketing messages, or you as a personal brand needs to be stronger, where people are actually actively finding you. You need elevated communication skills are needed, because the sales is all about psychology and how you're perceived as opposed to actually how good you are. Now that's an unfair statement, but it's a fact of life. People don't spend the big bucks because they fully understand the clinical dentistry that you do. They mostly go on trust in you and the practice and the value that you're providing. They understand trust and value, and therefore enhanced communication becomes key and very instrumental in how successful you become. You'll need a better and more sophisticated systems to enhance your patient journey and experience in your practice. Therefore, as part of that, you need a better case acceptance process. You can't rely on what the practice is doing alone. You have to develop the systems for each dentist and each clinical provider, and then all those systems need to work in cognizance with each other. And because you're dealing with higher fees, you need to understand how to communicate this, how to do financial negotiations, how to present the higher fee-based treatment plans to your patients in a way that engages them and is easily understood by them. And therefore, all in all, you will require more of an organized approach to sales. So if you want to eliminate the wall, you're going to have to change a few things in order to grow, expand, and advance. What you need is a proper sales system so that you have a consistent approach to sales. Your team are also going to need enhanced verbal skills and elevated communication skills, which allow them to better engage and interact with your patients, so that you are all aligned with the brand perception from the patient's point of view. This often involves improving your customer service and adding much value to your services and what you offer. And this again will help you to differentiate yourself from other practices and other dentists. And finally, you want to integrate internal marketing strategies within your growth systems. If you miss out on any one of these pieces of the pie, you will diminish your returns. You need it all happening in sync and in conjunction with one another if you want to gain a return on your investment of money, time, energy, and resources, such as your team. In the process of attaining success in our own practices and for our own coaching clients and within the industry, we've developed a winning formula that actually works. It's been the secret to our success. We've actually now systemized gaining and increasing your case acceptances in a significant manner. Our formula to succeed has been tried and tested, refined, and absolutely, I can tell you, proven to work. And it's been proven to work with anyone. So now, even if you're not a natural salesperson, we provide you with all the tools, techniques in our Systemised program where you can achieve the success that you want. Looking back over 30 years of a fulfilling career that both Rahul and I enjoyed, we can now see very clearly what worked and what didn't, and how to overcome your challenges. We can help you to avoid expensive mistakes and stop wasting your time and overcome many of your challenges. And for the first time ever, we're actually sharing that with you, and not only with our portfolio of practices. We've developed an online program with mentorship that specifically for dentists like you in mind will address all of these requirements in a methodical and easy to understand and implement manner. Not only this, but we've developed a case acceptance process that has been proven to work for anyone who chooses to implement these strategies. Our directives are aimed at winning solutions for you, your team, and your patients. This will produce a productive, growing, and healthy practice for all. You'll have access to online support training of over 65 videos in 12 different modules, each with specific action plan videos and workbooks that tell you exactly what to do. You'll also have access to additional bonus material that I keep loading up to keep you current and updated, and also you will get mentorship coaching so that you achieve the vision and the objectives you initially set out to. You will have personalized, customized coaching sessions. This will help you to develop the right strategies and integrate the correct systems within your practice. These are really unique, and we've found over the years people have found these invaluable. What we want you to do is to develop a stepwise process for gaining greater case acceptances of more fuller and comprehensive high fee-based treatment plans. That's what it's all going to be about. And also, we want your practice to be team driven. We want this sales process to be team driven. This means that you don't have to rely on your clinical providers to sell the cases. All the value you need to add and the process is driven by the team. This enables you to create an efficient and effective, cohesive team of all that are focused on helping your patients attain the best outcome in their oral care. The good thing here is that we have an online learning platform for the entire team. Our online workshops include enhanced communication skills, verbal skill training, how to carry out a comprehensive examination, how to do case presentation, all that encourages patient engagement. And we facilitate this with improved customer service. These sales protocols will have a direct impact on your bottom line, and your team will be able to learn this at the convenience of their own homes. So they don't have to learn this whilst they are working in practice with you. All the possible team training you need for increased sales is provided for you. All the forms, documents, protocols, verbal skills and tools are all given to you. You simply need to put it into action. And as I mentioned, the team find this wonderful because they can learn in their own time and in their own space. Training in verbal skills or having elevated communication language is really critical, and we will provide you with all the wording that you need in the right sequence according to your bespoke sales process. This will enable you to add more value for your patients because you'll be able to better understand your patient. And this in turn will help you to distinguish yourself from other practices, creating brand ambassadors and raving fans. Now, it's really critical to understand the psychology behind sales, and this module will help you to understand patient purchasing behaviors, which will then facilitate you gaining greater case acceptances. It's really important to have enhanced telephone patient management skills as well, because this is where all your marketing actually comes to life. And we'll cover every eventuality when communicating with potential patients to help choose your practice over others. We'll share unique telephone management structure that will help get patients into your practice. You'll also learn how to best manage different personality types using a well-established stepwise process of new patient consultations. And this will help you to co-discover with your patient their exact needs and requirements. If you know that, you'll be able to sell them the appropriate treatments. These days, it's also good to offer your patient e-consultations. And so we have a module on there which will help you to get the very best out of virtual consultations to add significant value to your patients as well. Now, integrating a treatment coordinator role can be quite invaluable. However, not all practices can or do create a treatment coordinator role. So we'll show you the benefits of it financially, but also how to incorporate the role without any additional expense to you. And there's a very easy way of doing that. Of course, the entire team needs to have that elevated communication skills so that you can build value in the right patient perception that you need right from the start. And the program enables personalized verbal skills to enhance your communication in the correct way so that you're giving the best messages that are interpreted in the correct way. We'll also show you methods of integrating co-discovery techniques within your clinical examinations to get improved patient awareness and optimal patient engagement. It's also important for you to know how to present your patient treatment choices and options in an optimal way, but also how to present the fees of these uniquely designed and structured plans in a way where patients are accepting of this and it makes it affordable for them as well. What we're looking for is solution selling verbal skills, and we've compiled a unique set of verbal skills. It's actually taken us 30 years to prove this to work consistently, and we'll be sharing that with you. It'll help you to overcome all your challenges and promote an increased case acceptance rate. Not only this, but for the first time ever, we're actually sharing a uniquely recorded set of verbal skills with you that me and Rahul have conducted that will really help you to understand this process in action. We want to align the patient perception with what you are trying to provide and with a huge impact on value. Therefore, brand perception falls part and parcel of internal marketing. You want to be able to do cost-effective internal marketing that will then start attracting other patients to you. We have formulated a unique structure of doing this so that you talk about marketing and talk about promoting your practice at the right time in the right way with your patients. As I mentioned, you will have action plan videos and workbooks associated with each module. These highlight the practical strategies and the philosophies behind it and will help you to action what you need to, because it specifically tells you what to do for you and your team. You will shortly see your revenues start increasing as more and more patients start accepting your treatment advice and are happy to go ahead with the treatment. Your treatment acceptance rate for comprehensive care and high fee-based treatment plans will start increasing. But not only this, you'll be able to produce increasing revenues on a regular and consistent basis, not just for the short term. This program has been uniquely designed to help you develop sales process in a highly impactful and effective way so that you attain those consistent results. Also, the best thing about these processes is that you will be able to see quite clearly where all the blockades in the system are so that you can refocus and redirect your energies towards extinguishing them. As I mentioned to you, all these strategies have been proven to work. We've used them ourselves in our own practices and in those practices that we have coached over the last 30 years, and we've been refining it ever since. They have all the strategies, techniques and solutions have been tried, tested and absolutely proven to work. This is not theory, guys. This is practical solution in action. And it's been brought to you by 30 years of our experience, both mine and Rahul combined. We've seen success in 100% of practices. We've proven the increased revenues of 20 to 30% in all the practices we've worked with as a minimum. And we've actually pioneered the TCO role in the UK, and we've trained many coaches and consultants that are now teaching this role to others. In fact, we've developed an innovative new patient experience and journey that has been proven to increase the case acceptance, and this we've been doing since 1991. As you can see, there's much that we have to share with you, and much that can help to improve your practices and grow in the way that you need them to grow. If you want more information, do go to dentalwealthbuilder.com. However, please do reach out to us as well if you have any questions. You can reach us easily on bhavna@dentalwealthbuilder.com. And I'll be more than happy to answer any of your questions and help you find a way forward. I'd like to thank you for your time today, and I hope to speak with you soon. Thank you.